Hello, how you doing?
Hi.
I'm Laurice Carter,
Brent.
VA. Oh, Brent, how you doing?
I'm all right. How are
All
you?
right, doing good. Thank you for making it today. Before we start, I'll let you know everything here that we speak about in this meeting is confidential. If there's anything that seems life-threatening or puts you at danger or harm, I will have to report that. But other than that, just between me and you, everything is here. Okay. I believe from our initial intake, I have some information I just want to go over to make sure. And I believe your name's Brent. What's your last name?
Carter?
Carter, okay. And you're married, you're a veteran, and your wife is from Germany?
Yep.
Okay. And I believe you stated you was on multiple medications? Okay. And you're requesting help from the VA? Okay. So what brings you here today? Do you have any issues that's bothering you today? What's going on?
I don't feel good,
Okay.
and I got a lot of pain. But I think need to talk about my alcohol use.
Alcohol, okay.
I know they told me I probably, when I was here before, maybe not drink on my medication.
Okay.
So,
All right. I'm going to ask you a few questions. Some of them we probably already asked or we may know, but we just to make sure everything is correct, I'll go over them. So we already found out your name's Brent Carter? Okay. And your date of birth?
3/17, 1954,
Okay. And your last four?
9752.
Okay. And you're a U.S. citizen? Or?
Yes, sir.
Okay. Okay. Getting into some of the questions. Continuously homeless have you been for the last year?
No, sir.
Okay. 3 or 4 more episodes of homeless in the last 3 years? None?
No.
Okay. Any chronic illnesses?
Well, my back.
Back, okay. Are you being treated for that, for your back?
Uh-huh.
And any mental illnesses?
Well, maybe.
Okay. What do you,
Kind of feeling, we talked about PTSD and anger and maybe some depression and
okay. And was you born with any developmentally disabilities?
no.
Okay. Any substance abuse?
I mean, I guess that's why I'm here to
Okay.
talk about that. I don't think it's a problem.
What substances?
Alcohol.
Okay. Any other drugs or anything?
I mean, I take my pain meds.
Payment. Okay. And what is your veteran status? How was you discharged? Honorable?
Honorably.
All righty. And that completes that. So I understand that you're having, or there's some issues with alcohol drinking, drinking alcohol. There is it's called a CAGE questionnaire. I'd like to go over that and ask you, it's just 4 questions, and we will answer that, and at the end of that, I will get with my supervisor and we'll make a follow-up appointment. Is that okay with you? Okay. And once again, everything is confidential on here, so we're just trying to see what's the best way, what's the best method we need to take to assist you. Have you ever felt you should cut down on your drinking alcohol?
Well, I don't know that I have felt that, but my wife sure has.
Okay, how do you feel?
I mean, I don't want to give up drinking. It's all I got.
Okay. Have people annoyed you by criticizing your drinking before?
Yes.
Okay. Have you ever felt bad or guilty about your drinking?
It's been a couple times.
Have you ever had a drink first thing in the morning to steady your nerves to get rid of a hangover? Or what they call an eye opener? Have you ever had that?
I mean, yeah, what's the morning?
All right.
Before noon?
Yes.
Yes.
Okay. All righty. We got those results. I'll go speak with my supervisor. We'll make you up a follow-up appointment. If you have any questions or need anything, of course, you can give us a call at our office. If you see the secretary out front, she'll make a follow-up appointment for you.
Sounds good.
All right. It's good seeing you today.
You too.
Take care.
Bye-bye.
Hello. How you doing?
Hi, how are you?
Brent? Okay. It's doing good. All right, I see we made a follow-up appointment, and I'm glad you could make it today. How's the weather?
Rough outside.
Yes, it is. Okay. The last time you was here, we did a cage questionnaire. Do you remember that?
I do.
That was in regards to your alcohol intake. That test showed that there is potential risk of alcohol abuse. If you score 2 or more on that test, then you're at risk. So if it's okay, I'd like to go further with some questions to see if there is some issues with your drinking. These are a little bit more specific than last time. I think last time it was 4 questions. So if you don't mind doing that, this comes from the Model 4 screening, just to let you know where it's coming from. And once again, everything still is confidential here. And if you have any questions, you can stop me. Okay? All right. How often do you have a drink containing alcohol? It's either never, monthly, or less, 2 to 4 times a month, 2 to 3 times a week, or 4 or more times a week. And I can repeat those if you
4
need.
or more.
4 more times a week, okay. How many drinks containing alcohol do you have on a typical day when you are drinking? 1 to 2, 3 to 4, 5 to 6, 7 to 9, 10 or more on a typical day?
5 or 6.
5 or 6, okay. How often do you have 6 or more drinks on one occasion, or have you?
Every couple of days, maybe.
Okay.
When I get my check,
Okay.
it's more.
So it's daily mostly?
I mean, I'm drinking daily, but I would say,
You said every time you get paid?
anytime I get a check, usually like once a month, I blow it out
Okay.
more.
Okay. How often during the last year have you found it difficult to get rid of the thought of alcohol, get it out of your mind, just thinking about alcohol?
I haven't tried.
So you never had that issue?
I haven't tried to, except since we first met.
Okay. How often during the last year have you found that you were not able to stop drinking after you had 1 drink or more? Has it been difficult for you after you started drinking sometimes? Okay.
I usually drink till I pass out.
Pass out, okay.
I don't think about stopping.
Gotcha. How often during the last year have you been unable to remember what happened the night before because I guess you had too much to drink?
All the time.
All the time?
Well, that's what my wife tells me anyway.
Your wife, okay. And I believe this was one of the questions we asked before, but how often in the last year have you needed a drink first thing in the morning? Never, less than monthly, weekly, or daily?
Not every day, maybe weekly.
Weekly, okay. How often during the last year have you had feelings of guilt or remorse after drinking?
Weekly, probably.
Okay.
I just don't like listening to my wife complain.
Okay. Has anyone or you ever been injured as a result of your drinking?
Yes.
Okay. Do you mind stating who that was?
My wife
Your wife?
had a couple of fights.
Okay. Was
She
this
starts it.
emotional or physical or both?
Both. She starts it. She's just,
Okay. Has a relative, friend, doctor, or any other health worker been concerned about your drinking?
I don't have many friends.
Okay.
You're the first person who's asked me about my drinking.
Okay. And your primary care provider, he has you on medications, right? Okay. Alrighty. Yeah, it seems that from this, of course, I'll go over it with my supervisor, but we may have some programs and some different resources that we can help you with your drinking. Do you feel like it's a problem? Do you want to get some assistance with it?
It seems like every time I've talked to you, it makes this, it's kind of is obvious that there's a problem
Okay.
here.
All right.
So, I mean, I'm willing to talk about it.
Okay. Alrighty, I'll go over the results, and like I said, I'll get with my supervisor. We have different programs that we can help veterans with, And it's in regards to your PTSD, of course, we can work with your primary care provider and trying to get you some more assistance. Are you just seeing the primary care provider, or are you seeing anyone in mental health? Okay, we can try to see if we can get you a referral over to mental health so you can speak to someone about your issues with PTSD, or you can come and see me. So we'll just see how, the best way we're going to do to assist you. And we will make a final appointment, and then from there you'll be in the program. And if you have any questions, anything that bothers you, anytime, you can call us, and there's a hotline that you can call. And of course, I'll give you that information up front when you leave. So is there any questions that you have at this time?
Will I go into detox?
It's not really detox. We do have a program that could help you detox if you feel like that's what you need to do. We have more or less, I believe some of them are the Alcohol Anonymous, a couple other programs that they have here. I think the best thing to do right now is probably to get you over to the mental health clinic here, and we'll go from there. It's probably the first step we need to do.
Okay.
Does that sound good? Mm-hmm. All righty. I appreciate you coming.
Thank you.
All right. Take care. Have a good one.
You too.
And we'll go right out here to the front.